Good evening and welcome to Pinski Dermatology and Cosmetic Surgery. For those of you who I haven't met yet, I'm Dr. Kevin Pinski. We are truly delighted to have you joining us here this evening. Before going further, I'd like to extend some definitive thank yous to our friends in the pharmaceutical industry, Allergan Aesthetics, Skin Better Science, MERS, Neocutis, Elta, SkinCeutical, Suniva, Revision, and NRL. I would also like to extend a deep felt gratitude and my staff who have kept me sane throughout these crazy last 2 to 3 months and have tirelessly put this all together to make it come to fruition tonight. So thank you all. I truly appreciate it. I would like to introduce one of our newest provider, Tinsi Uman, who comes to us from Detroit with a few years of experience. And if you haven't had the distinct pleasure of meeting her yet, you certainly will. She's an awesome asset to our team. Thank you. And most importantly, I would like to thank all of you because you're taking time out of your busy lives to spend time with us this evening. And I can't express the extreme gratitude that I have for all of my existing patients who have been loyal through the years. I am truly humbled and honored. And for those of you who I haven't had the pleasure of seeing yet in the office, we can only hope that we gain and earn your trust and that we not only meet, but we exceed any and all of your expectations. It's very humbling to hear that we have 200 of you listening in and viewing us this evening and joining us for our virtual open house. We are ecstatic. We are not only ecstatic for this, but we are ecstatic to hopefully entertain and educate you this evening. However, over this last crazy few months, I hope that you and your families and loved ones have been healthy and well. These have been crazy, unprecedented times. For me personally, it simply reaffirmed the value of human life and the importance of living each day to its fullest and the need for companionship. We cannot wait to open our doors again June 1st. Safety will be our #1 priority. You're going to see some of that tonight, hence the wonderful masks that you see all of us wearing. For the next 90 minutes, though, again, sit back, relax, get entertained, get educated. We're going to have all kinds of demonstrations ranging from injectable fillers and neuromodulators like Botox to body treatments such as cool sculpting and cool tone, facial aesthetic treatments like DermaSuite. And then we're going to have all kinds of wonderful raffles and promotions that you're going to hear more about from our cosmetic coordinators. Also, I would be remiss if I didn't remind you, we want to hear questions so that we can provide answers to anything that you may want to know more about. We will answer those throughout the evening. As always, I'm sure there will be more than we can get to based on the time allotment, and we will email answers back during the next few days. So again, with that, let's forget about life for the next few minutes, for the next 90 minutes, and let's start by raising your glass. Join us in a toast, your champagne or your wine. And here's to better times. God bless all of you. Cheers. 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 I want to turn things over now to our co-moderators, our co-hostesses, our 2 cosmetic coordinators, Amber and Cassie. Thank you.
Hi, everybody. We're going to be following me this way as we're going to be following Dr. Pinski into his first treatment room. So for this room, we're going to actually be doing a really great example of some of our many packages that we'll be giving away. This is a good example of our Refresh and Restore package. You follow me in right here. Here's Dr. Pinski.
All right. So we're in here with Pam and our assistant Kim. Pam has thankfully volunteered to have a bit of filler and some neuromodulator. And I would say this is probably comparable to what we have been talking about as far as refresh and restore. Refresh and restore is replacement of lost volume and the usage of neuromodulators, again, like Botox. So I'm going to go ahead and draw some injection points as I'm discussing. But what's important, the main thing to keep in mind, fillers do just that. They fill. They replace lost tissue, lost volume. This is inevitable. It happens to all of us as we mature at different rates and in different areas. Neuromodulators, on the other hand, relax muscle movement. In addition, I'm going to show you some things that are off-label, but we do all of this in our office on a daily basis, and you will see that this is done painlessly, hopefully with no bruising. Most patients can do this and go right back to work afterwards. So Pam, what I'm going to have you do first is just, if you would be so kind, go ahead and raise your brows. And I'm just making a few dots to facilitate our demonstration today. And these are going to be my injection points for her Botox. And let's have you, if you will, go ahead and smile. Big smile. That's great. And relax. I'll have you turn this way. Big smile. And relax. And I'm going to place just a tiny drop out here. A little more softening. Again, what we're trying to achieve is a natural, rested, relaxed look. We're not going for a frozen look with Botox. I hear that a lot. That is bad for the patient. It's bad for me. You don't, no matter what you think, you don't want to be frozen. You want to have some animation. Go ahead and scrunch your nose like a bunny rabbit and relax. Relax. And lastly, if you will, go ahead and just push up with your bottom lip. Thank you. And putting one right there will help to just smooth out the chin, almost as if there's been a little chin implant. Now I'm going to use a different marker. Let's make just some marks for filler. We're going to use Voluma for Pam's cheeks. I love Voluma because it's really soft. It gives a nice lift and a nice fill. And it lasts approximately a year and a half, which is longer than most of the other fillers that we currently have at our disposal. All right. And then we're going to use a little bit of Juvederm to help soften this little pre-jowl area. Kim, I will take another glove, please. And last thing we're going to do is use a little radius. We're going to use a little radius to help redefine Pam's jaw by pulling back in this direction here. Just like that. So due to time constraints, you're only going to see me injecting half of Pam's face. I'm not going to let her walk around for weeks without doing the other half. We will do that. That would be just crazy. Actually kind of neat, but we'll get to the other one off camera. Thank you. All right. Why don't we go ahead and start injecting? I'm going to put that table back and up just a little, Pam. Comfortable like that?
Yep.
Great. All right, so I like to start with the filler first. Let's go ahead and do a little bit of Voluma for the cheeks. And we're going to do 2 injectable patients this evening. Both of them have had topical anesthesia. I use topical anesthesia in the majority of my patients for fillers. I don't believe in any pain. I don't do nerve blocks anymore. For Botox, we do not use anesthesia. We simply use ice. So we'll generally tell patients, get in here, about 10 or 15 minutes before your appointment so we can put topical anesthetic cream on. And as you can see, with that small amount of topical anesthesia, this can be done extremely comfortably. Pam, how we doing?
Great. I'm feeling a thing.
Beautiful. This is the first time Pam has ever had any treatment. Actually, I'm surprised she kept a straight face. Pam has been our assistant for many years. And I don't know if it's one of the perks of having great staff or it's a perk of being a staff member, but somehow or another, we all work well together in trying out different treatments and procedures.
Dr. Pinski, what do you suggest if someone only wants to treat one area or have one syringe?
So that's a great question. And it's also a difficult question to answer simply because I don't like half treating somebody. However, it often comes up where someone will come in and say, I just can't afford to do all of that. Let's work on one thing today. And then maybe, in 3 weeks, I'm going to be back. Let's do the rest. You have to look at each patient individually and see what's going to give the most bang for the buck. I would say usually that case, it's going to be the cheek. But the one thing I don't want to do is do a tiny bit in the cheek and a tiny bit in the temple and a tiny bit on the jaw and a tiny bit around the mouth. Because guess what? They're going to get virtually no result. They're going to come back and say, your treatment didn't work. We can't treat the whole face with one syringe. All right, we're going to try to soften this little jowl area here. Our goal is to hide shadows. And again, it shouldn't take much, just a little bit. This is Juvederm Ultra Plus. The other thing that's important to point out, these fillers, the Voluma and the Juvederm, consist of hyaluronic acid. Hyaluronic acid is almost a perfect filler. It's already in our bodies. You can't be allergic to it. And God forbid there's ever a problem, like a bruise or an occlusion of a vessel, more importantly, or a lump or a bump that we don't want to see. We can reverse that lump or the bump or the occluded vessel with an enzyme called hyaluronidase, which will dissolve it. Pam, how you doing? All right?
Good. Very good.
So Dr. Pinski, I've never had any of these injectables. What side effects do I need to worry about?
Well, some of them I just mentioned. Probably the main side effect that we have to at least talk about beforehand, and we always talk about these things before treatment with the patient. Anytime you put a needle into the face or anywhere on the body, because we're still going to do hands, you may get a bruise. I don't know. Most people really don't think of that as a side effect, but yeah, I would include it in there. Yeah, you could always get a potential infection. That's really unlikely. You can get a lump or a bump. And again, we can reverse those things. The bad side effects that you hear about with fillers, we just don't typically see that. I mean, there are some bad things that have occurred in the history of fillers, such as people going blind. But most of those cases come from the Asian literature, and they have to do with injections right here. Although truthfully, it can happen with injections anywhere on the face and with any filler product. I'm going to have you turn just a little. We're going to throw a little radius into the jaw area. And again, the purpose of this is simply to get this little pullback. But you can already see with just a little bit of Juvederm, we've gotten that little jowl already hidden very nicely. And this is a great treatment in somebody with some lax skin who just needs a little pullback. It's also a wonderful treatment in somebody who's had a facelift, because facelifts only last about 10 years. So at about 10 to 12 years, they start getting a little bit of that reversal of the treatment that they just had with the facelift. And then we can go ahead and put a little radius in to simulate the same type of an effect. And the beauty again of all of these fillers, if you came back 3 weeks later and you didn't like it or there was a problem, we can reverse them all. Even with Radius these days, we know of an antidote to reverse it. Botox, on the other hand, it isn't reversible, but in answer to your question, Amber, what's the worst thing that can happen with Botox is a little bit of facial asymmetry, or we leave somebody with a brow arched or a lid that's drooping, and we just have to know the anatomy and how to fix those things. Let's go ahead and do a little bit of Botox, and then we'll move to treating Pam's hand. But hopefully already you can see that we've gotten some softening here of the nasolabial fold. We've gotten some softening of her chin. Her jawline appears better already. The Botox, you're not going to see the effect right away. Botox takes 2 to 4 days to typically kick in. The Botox will then last somewhere between 3 to 6 months. Great thing with Botox that I try to stress is prevention. We don't have a whole lot in medicine that's preventative. So if you never let your Botox wear off there and you continue to do it, you will start to retrain those muscles. So that instead of lasting maybe 3 months, it's now lasting 4 to 4.5 to 5. We'll do that other inferior lateral. Okay, I'm gonna have
Dr. Pinski, do topical retinoids need to be stopped prior to getting injectables?
No, not at all. In fact, I love for patients to be on topicals like retinoids or growth factors, because I think that what they do is help retain some of the aesthetic results. We'll just do all 3 of those that we are achieving with fillers, Botox, and some of the other facial treatments that you're going to see. Truth be known, however, I don't think that retinoid or any of those fillers are really going to prolong a deep placed filler that much. All right, so let's finish up last couple areas of Botox on this side, and then we're going to treat one hand. The filler that we used here should last approximately 10 to maybe 12 months if we're lucky. And we'll do nasalis. And then we're going to treat the hand. Perfect. Thank you. Great. All right. Well, let's also treat just a couple of little lipstick lines. So Botox around the mouth is great for, go ahead and purse, for softening these tiny little lipstick lines. And it gives just a slight eversion of the lip border. You don't want to do too much or be too aggressive. If you do, then you're going to run the risk on changing the way someone speaks potentially, or their ability to sip out of a champagne glass like tonight. God forbid, we don't want to do that to Pam. I won't hear the end of that. All right. So we've treated the face. We can't forget about treating somebody's hands. As we mature, we lose tissue in the hands, and then we're unfortunately able to see tendons and blood vessels. So with a little bit of filler, and I love Radius for this, we can get that to appear like this, and that should last somebody about 1 year. And we used to not do anything for the hands, and I think it was sort of a dead giveaway that they've had treatment or as to somebody's age. So why not do both? Why not do body treatments as well? Décolleté, neck. Neck has been kind of a bane of our existence for many years. But thankfully, as we've gotten further along in time and in our careers, these types of procedures have been developed. Pam, how's the discomfort on the hand?
It's great with the topical numbing. I really don't feel anything.
Fantastic. And I thought it was all my ability, but I'll
Well,
give it
there is that.
credit. Actually, it helps to have a great patient and a great assistant. And yeah, the topical numbing plays a little bit of a role too. So it's just lots of little tiny injection points. And as far as aftercare for all of this stuff, I just tell people you don't want to go and get a massage for the next 4 to 6 hours because potentially that filler material may be moved. Hands, I really don't think there's much in the way of restrictions. Let's apply a little pressure there. And then the last thing to do is just apply a little bit of ultrasound gel to clean things up and make everything look pretty. And again, we're lucky we didn't get much bruising at all. In fact, I don't see any. Pam is a good friend and I would not be able to hide if that was the case. So there was absolutely zero pressure. And that is a typical refresh and restore treatment. And then let's put a little of this on the hand. We'll make a fist. With Radius, you can get a little bit of lumping or bumping from the filler, especially on the hands, because you don't have much fatty tissue on the hands. And that goes away in 24 to 48 hours. But otherwise, what you see is what you get. And if we now compare, you can flatten them as well. Where you see the little white bumps, that's going to stimulate some collagen to form, and all of this should be really nice and smooth. We'll let you hold a little bit of pressure, and then I think that we are done in this room, and we can go next door now.
I can take you for some raffles. Follow me. We'll go meet Amber. Okay. What are we starting with, Amber?
We are going to start with our Alpha basket.
Alta? Okay. You want to draw?
Yeah.
Make sure she's going to call a name. Make sure you raise your hand. It's at the bottom of your screen. So if we call your name, raise your hand, and we know that you're here, you're watching, and then we can reach out tomorrow, make sure we can send you your products.
It'll be located at the bottom left corner of your screen. Our name, our first raffle is actually a very familiar name to me. The Alta basket is actually, in fact, going to Michelle Stovall.
Michelle, do we have a hand raise?
Good.
Awesome.
All right.
Perfect.
Congratulations.
Okay, next one, you want to do Skin Better?
Yes.
Okay, I feel like you're having good luck, so you should keep going.
Okay. Let's see here. So for our Skin Better basket, we have Abby Downey.
Abby Downey, are you with us? Abby Downey? Okay, maybe we'll go to a rel right now, and then we'll give Abby one more chance to raise her hand. If not, we'll draw another name.
Yes, and Rel is our organic skincare line. Let's see who's getting this one. Kimberly File.
Peel? Kimberly Peel? Kim? Kim, hi, awesome. Okay, Kim, you're getting a rel with a Prosecco. Let's go back to Skin Better. Do we have an Abby Downey? Abby? No? Okay.
All right. We're
All
gonna
right,
pull
sorry,
another
Abby.
one. Let's see. All right. Mimi Garcia.
Awesome,
Yes.
Mimi. We'll send you Skin Better. Like I said, we'll be reaching out to you tomorrow. Make sure we have a good shipping address, and we'll get these products in the mail. Amber, where are we headed?
We are now headed to our thermogenal therapy room where we are going to meet our technician, Maddie. You come this way. Cassie has actually had Thermage done
Good
before.
evening, everyone. My name is Madi. I am an esthetician. Today we're going to talk to you about two different types of tissue techniques that we offer in our practice. The first one that we're going to offer is Thermage. With Thermage, I've been practicing, I've been doing treatments for 11 years with tissue technique, and it's one of our best tissue technique anti-aging treatments that we offer. When our patients come in, we can offer them, we can do different types of areas. We can treat their eyes with a smaller tip that we carry here in our practice. We can also treat the face, full face, and we can also treat the body. With our body tip, it's a little bit larger. If you kind of compare the two that we have here, a little larger, which means that we're delivering 4 times the energy from the face. So it's a little bit more intense. With Thermage, it is a radio frequency treatment, so we do need to ground our patients. So we do put a return pad on our patient just so that we keep our patient grounded. When our patient comes in, we go over the areas that they are concerned. I kind of evaluate. Due to the pandemic that we are going through today, I'm not going to have Morgan remove her mask, but normally we would go ahead and evaluate and see what our patient's concerns are. And with Morgan, we're going to just talk about her eyes because we can see her eyes. So with Thermage, what we would do is we would treat the upper eyelid. We would kind of go back and forth. Before doing her treatment, we're going to mark Morgan with a grid, which kind of helps me, it guides me to where we're supposed to treat. After we do the marking, I will begin the treatment. We do pulse at a time, which is delivering heat. During the process, my patient is feeling a little bit of like a coolant delivery, and then it begins to deliver a little bit of heat, and then it goes back to the coolant delivery. After we are done, we do multiple passes back and forth. My patient's going to end up a little red, not too much, a little bit swollen, which will go away in about an hour. When we are treating the eyes, we do use what we call an eye shield to protect their eyes. When we're treating face, we're not using anything, no protective, because it's just heating. So she's okay without having any protecting around the face. After we're done with the treatment, again, a little bit swollen, Morgan will start to notice her results in about a month to 3 months is when she noticed her true end results with her treatment. Afterwards, Morgan can go back to her normal routine. She can apply makeup if needed to that area, and then she would follow up in 3 months just to evaluate and see how we're doing. After her evaluation, we will decide if Morgan will need another treatment. Normally, patients just require 1 treatment after Thermage.
Madi, is the Thermage treatment painful?
Our patients feel a little bit of like a stinging, burning sensation during the process, but it's just during the delivery is when she's feeling it. After that, Morgan is back to normal. She doesn't feel any discomfort afterwards. Good to go on her normal routine. After the Thermage, we are now going to move over to what we have. Our second device is Ulthera. Ultherapy treatment is a treatment that uses imaging. Ultrasound imaging is what it uses. This is similar to, it also does a tightening, but it's a little different. This, depending on the patient, the laxity of our patient's skin is how we would determine which one we would use on our patient. The beauty of having the 2 devices in our practice is that if my patient needed Ultherapy on her lower jaw, but needs a little bit of a lift on her eye, we can cross two treatments at the same day, at the same time. There's a little bit more of a downtime with the Ultherapy, only because it does go a little bit deeper. So prior to doing the treatment, our patient does require a little cocktail, a little pain regimen, just so that they're comfortable during the treatment. When our patient is done with the treatment, our patient will be a little red, a little swollen. Some patients do develop a little bit of bruising, but the bruising does go away within 1 to 2 days, depending on their patient. Same thing with Ultherapy. It requires 1 treatment to the area that we are treating. The main treatments or the main areas that we treat, lower jaw line. Other than that, that is our Ulthera treatment for today.
Perfect. Now, Madi, how would you compare the Ulthera treatment to the Thermage treatment?
The difference between the 2 of them, the Thermage is more of a radio frequency, whereas Ultherapy is more of an ultrasound. The beauty of this also, it has an imaging where I, the tech, or any provider that's treating the patient, we can kind of see and target the areas that need to be treated. So it stimulates the heat. So this goes a little bit more deeper than the Thermage. Thank you.
Thank you, Marty.
Okay, this is a quick hop right next door to be back with Dr. Pinski for a silhouette insta-lift discussion.
Hello again. All right, I'm going to change gears now, and we're going to talk about probably a relatively new treatment for a lot of you. It's called silhouette or insta-lift. And these are suture threads that are used to lift and to a certain extent fill the skin. They come in this sterile package. They are made from a degradable, biocompatible material. It's actually the same product that we've used in skin surgery, in dermatology, and plastic surgery for decades. So they absorb very well. There have been others over the decade or two prior to this that were made out of products that really didn't belong in the skin, like metal and copper, and they were fraught with problems. This is a good product, and it has wonderful, wonderful results. The true indication is for mild to moderate skin laxity. I'm going to have Dominique just turn to the side. The typical placement will be right here to help lift and soften the cheeks. We do a pretty good job with fillers in that location. The other area that I will commonly use this is right along the jawline, sometimes even in a hockey stick formation, to do this. So putting them both together, we can obtain an effect like this. This is an area that we don't do as great a job with fillers, and I'm the first to admit it. So this is a wonderful treatment for that area in particular. And we will also use this on somebody's neck if they have a lot of neck laxity to give a little pulling like this. So, you know, I mentioned it also acts like a filler to a certain extent. These things help provoke the body's natural wound healing response to stimulate collagen formation. They are not going to take the place of a filler, but they will augment what we already use a filler for a little bit of recontouring of the cheek, for instance. Dominique actually would be a wonderful candidate for this. This is typically for somebody maybe in their mid-30s to mid to late 60s. And somebody who's really severe, this is not going to take the place of a facelift. However, with a facelift, which lasts typically about 10 to 12 years, you heard me say that earlier, this is going to last about 1.5 years. And I've seen, again, it depends on patients. I've seen it last longer than 2, and I've seen in some cases rarely less than 1.5. So the duration may not be as good, but the cost is significantly better. There is no cutting, there is no scarring. Many patients who may even need a facelift opt for something like this. Many plastic surgeons are now utilizing this and doing less and less facelifts. So in that regards, I think this is a wonderful treatment. It is done here in the office in a room just like this. Local anesthesia takes me about 45 minutes. Patients can go out after, they can drive home. The suture material dissolves over about 120 days. So the results actually get better and better and better during that time. And again, it's typically a predictable treatment. They may get a little bruising, may get some redness or swelling, but as far as severe side effects, we don't typically see that. So let me just show you what one of these sutures look like.
Dr. Pinski, I hate pain. How painful is it?
Well, I hate pain too, and none of my patients like pain. The worst part of this whole treatment, without a doubt, local anesthesia. So we'll typically give 6 little tiny blebs of anesthesia for 2 threads. And other than that, it is not a painful treatment. It is not painful after. Some people do need a little extra strength Tylenol that night, but it is not a terrible treatment and a terribly painful treatment. Otherwise, we wouldn't have repeat treatments. And we've been doing this now for 4 years, and we do have some who have already had a second thread done, and but also in other areas. So we use a little guide needle on either end of the suture thread. This needle, which, yes, it may look a little long, is the exact same diameter of a needle that we use, and you just saw me use, for fillers. So the insertion point, we insert, we thread the suture, and then we exit. The insertion point and the exit points heal up overnight without any marks. I'm going to have the camera, if we can, kind of zoom in a little. It's tough to see, but I'm going to put it on a black background. And you can see on that suture thread are tiny little cones, 8 of them, and tiny little balls, 8 of them. Once we get that suture thread in place, we are going to, quote unquote, set the thread. And we basically move the little balls into the cones. And that's what grasps the skin and helps to lift the tissue in place. And it's also what helps to stimulate collagen formation.
I have heard horror stories about suture lifts. Can you elaborate on that?
Yeah, absolutely. I'm actually glad you brought it up. I thought I alluded to it just a little, but all of those horror stories really have to do with outdated material that should never have been used. Again, they typically were made from metal, some were copper. These are things that don't belong, they're foreign material. They don't belong in our skin. Our body's gonna sense them as being foreign and they spit through the skin. Some of them had a little barb at the end, like a piece of barbed wire, which anchored it. And that would spit through the skin later on. So those were horrible. They ended up being rejected. This is a biodegradable, biocompatible suture that dissolves.
What if I don't like the results?
Well, thankfully that will never happen. No, usually, and I can tell you this, to date, I've never had to go back and remove a suture thread. That is potentially feasible. Somebody comes in 3 weeks after and they just, they should have never done it. I'm going to do everything I can to tell them, let's watch this. It's going to get better. What don't you like? But if we really, really needed to, we could remove these threads within that 120-day period. I try not to do that. We do a lot. Half the procedure for me is looking and planning and drawing out. And we go back and forth and we take our time very carefully. But again, if we had to reverse it, we could during the early stages, but knock on wood, in my 3.5 years of doing this, and it might even be longer than that now, I've never had to do that.
And then just another question that's coming in from a few viewers. Can you go back on why do this over a facelift?
Yes. So somebody doesn't want the price of a facelift. Somebody doesn't want cutting or potential scarring associated with facelifts. And somebody who's actually not a facelift candidate, somebody who's not severe. This is not a facelift candidate. This could theoretically be an Instalift or suture thread candidate. Pam could also have gotten away with this. But I am not going to use a facelift in a mild to moderate patient with skin laxity. I think that this is a great treatment to combine with other things too. And I've mentioned fillers. If you're a filler patient, you're still going to get fillers, but you're not going to do it as frequently, and you're not going to be getting as much if you have this treatment, especially in an area like your cheeks. And you just saw next door Ulthera and Thermage, facial tightening treatments. Those are wonderful treatments to combine with this. All right. So I think with that, I'm going to close. If there's other questions, we'll get to them. But let's move on down the hall and see some other more exciting things. Thank you.
And we're gonna get you another glass of champagne. Follow us this way. And then we're gonna move into cool sculpt. Back with Maddie.
Well, hello again. How's everybody enjoying their day? So in this room, we are going to be talking about cool sculpting. But before I get started, 2 things I want to share with you guys. One, we talked about Thermage in the other room, and I forgot to mention that when you see Dr. Pinski back again, take a look at his eyes. He had his Thermage eyes treated. He looks fabulous. Second, I want to introduce Tammy. Tammy is our Bourbonnais esthetician. She also does cool sculpting, and she's my partner in crime. So you guys might be seeing her at the Bourbonnais office. Before we also get started with the cool sculpting, I just want to send some shout outs to my family that are watching and my friends and family that are being very supportive. And hopefully I get to see you guys in June doing the treatment. So here we have Sydney and Liz. Sydney's going to get a treatment on her abdomen, cool sculpting treatment, and we're going to do her treatment for the first time. So she'll be able to explain to you guys what she feels during the process. Liz is going to begin to wipe the area with what we call a disinfecting wipe. What it's doing is protecting her from frostbite. And it's giving her a layer of protection. For the treatment, after she does the wiping, she's going to apply also a cold gel pad. The gel pad is a second layer of protection. So again, no frostbite treatment. When we begin the treatment, Cindy's going to feel a little bit of a suction during the process, a little tugging pulling during the process, just for the first few minutes. Afterwards, we will release the pull button and it should numb that area. She'll be sitting here for 35 minutes. After her 35 minutes are up, I will come back and move the area. The area is going to look like a stick of butter. I will massage it for 2 minutes until it goes completely down and she's good to go. With the treatment, cool sculpting reduces 20 to 25% of fat during the treatment. So the fat cells that we are freezing are completely gone. That doesn't mean that they will not come back. If you gain 30 to 35 pounds, you may see it kind of distributing in other areas of the body. Cool sculpting is an amazing treatment. We've had a few of our young ladies here in the office that have done the treatment. Amazing results. Look forward to seeing you guys for our cool sculpting treatment. You ready, my dear? I'm going to go ahead and apply the applicator in the area. It's going to feel a little suction. Too bad. Okay. I'm going to go ahead and tuck my girl in.
Sydney, can you talk us through what it feels like right now?
It just more feels like a suction cup, like my skin is just being sucked up into the applicator more than anything.
We are going to go ahead and hit the hold button. Sydney is going to start to feel a little bit of a coldness going on in that area. About maybe 2-3 minutes, a little uncomfortable, but then after that, it's breezy. Sydney would be able to sit here. She can play on her cell phone. She can watch TV, Netflix, listen to a podcast. As long as she doesn't stand up, she's going to be okay.
And so, Mari, how would you say these are permanent, but you can still gain weight naturally afterwards? What does that look like?
So on the area that we are treating, it can be permanent as long as you're not gaining your 30 pounds. 20 to 30 pounds is what we kind of try to maintain. But yes, if you gain the 20-30 pounds, it doesn't mean that we're going to get it in the same area that we're treating. It will be distributed in other areas. Normally, a patient like Sydney will require 2 treatments to the area. Some, depending, may require their 3rd session, and they're separated 4 weeks apart to do the treatments. How do you go? Great.
Oh, this isn't too bad.
So I'm going to leave Sydney here with a little call button. She's going to go ahead and buzz me if she needs anything. Even if she needs a sip of water, she wants a magazine, she wants anything, she's going to go ahead and buzz me. Go ahead and buzz. I have a pager. Well, it will call me, and I will be back in the room to check on Sydney.
Mari, what kind of treatments would you pair cool sculpting with?
So cool sculpting is phenomenal with all the treatments that I'm going to talk to you guys tonight. You can really pair it with anything. So like, let's say her concern is to debulk and then tone. We would do the cool sculpting first, do for 2 sessions, 4 weeks apart. Then we would schedule her to do cool tone, which is something that we will eventually speak to you guys tonight too. Cool tone will stimulate also the muscle. But let's say she was concerned about laxity after, or she just has a little bit of loose skin, we can pair it up with Thermage, which is amazing. So
those are the treatments that we can do for the body area. Okay? Now we are gonna go ahead and take it with Cassie. Cassie will tell you about.
I'm bringing you for another refreshment. We had Jesus standing here with a snack. Please help yourself.
Thank you. And if you will follow me right this way, we're going to the first door to the left for our esthetician Emily's demo.
Hello, and welcome to our aesthetic treatment room. My name is Emily. I am one of the estheticians here at our Chicagoland office. I have been in the industry now about 9 years. Today, we are going to be demoing a treatment called the DermaSweep on our beautiful patient Marjorie. Marjorie is expecting a beautiful baby boy in the fall. So what's great is this is a pregnancy safe treatment. What I'm going to do before getting started with our treatment is just highlight some of our aesthetic treatments that we're so excited to get back to doing. I'm excited to say in July, we will be seeing our aesthetic patients again. With our virtual promo today, we are offering, if you call it schedule an aesthetic treatment, you will go home with a complimentary SkinCeuticals sunscreen, which it's one of our favorite sunscreens. So with that being said, another great facial treatment that we offer is called a micropeel. A micropeel is a combination treatment of dermaplaning and a really light chemical peel. Dermaplaning is using a one-use surgical blade to exfoliate the skin and lift off that peach fuzz that we all hate. Followed by that light chemical peel just gives the skin that radiant glow. Another peel that we carry is the BI peel. Unlike our micro peels, you will have about a week of shedding, so plan accordingly with the social calendar. But once that peeling time is done, the end result is beautiful. With our other treatment we have is the Clear and Brilliant. It is using a fractional laser that helps with fine lines, texture, tone, just really bringing that luminosity in the skin. And we offer packages of that treatment because it's really done best in a series. We offer a package of 4 for $1,400, scheduled about 2 to 4 weeks apart. Another office favorite is our microneedling skin pen package. That treatment is a collagen promoting treatment that helps to treat acne scars, again, skin rejuvenating, treating fine lines, wrinkles. And what I love about the skin pen is you can really customize your treatment. Hone in on those stubborn, acne scars or whatever your concern is. We can discuss it and really hone in on those areas. Now, those packages are both a series of 4 for $1,400. And by having that package, it really creates accountability between your provider and our patient to ensure that you get the best result. Our other fan favorite treatment is laser hair removal, which if you have unwanted hair, that's the way to get rid of it. Laser hair is also done in a series, and you name it, we can get rid of it. We are excited to say that we will be doing laser hair removal on the body in June. We'll have a couple days, so make sure to call the office to get scheduled for that treatment. I'm going to go ahead and get started with our DermaSweep on Marjorie. Machine is a little noisy. Don't be intimidated because it's a lovely treatment. So what this is going to do here is it's a 2-step process. This first pass is using a dry exfoliating tip. And I'm going to just be treating her side of the face here. I'm going to start up on the forehead. And this is just going to lift that superficial dead skin off of the face. You can see her pinking up a little bit, but by the end of treatment, that will subside. So we do this on 2 passes, and then we'll go in with an infusion, and we're going to use the hyaluronic acid because that is a pregnancy-safe infusion. This will get a little boring, so I won't let you hang out in here long, but I hope you enjoy the rest of our virtual tour, and we can't
wait to see you in July. So we have a little bit of a change of plans. We're gonna bring you back to a raffle really quick while one of our demo models gets set up. Okay, and I really like when Amber pulls the ticket because I feel like she does the best getting him through the bullshit. Okay, so let's start with the SkinCeuticals basket. Hopefully everybody's here.
All right, that is going to go, another familiar name, Tara Scroggin.
Tara,
Tara, can you wave at us? No? Okay, that's okay.
Tara, raise your hand. No, Tara.
That's okay.
Okay.
We will actually move on to our Neo basket. Anjali Patel. Perfect.
Awesome.
Congratulations.
We'll reach out to you tomorrow. Make sure we have a good shipping address to send it to you.
All right, moving on to our revision basket. That is going to go to Madison Deno. Do we have Madison? Perfect.
Awesome.
Congratulations, Madison. We're going to pull one more time for the SkinCeuticals. Ashley Poroy.
Paroy, Ashley Paroy. Ashley P.
No hand? All right, we're going to pull one more time for it then. All right, Cindy Avila. Cindy, it's at the bottom left.
You know what? Why don't we take a break on raffles? We'll come back to SkinCeuticals. I know someone wants to win this, and let's work our way down the hall to one of my favorite treatments. Okay, so we're gonna be back with Maddie doing body treatments. And one of our patients has had a few rounds of this, so she'll be really good to ask what it's like.
Hello guys, it's me again. So now we are going to be talking about cool tone. Before I get started with the cool tone, just a little, want to give you a little feedback on the cool sculpting. The cool sculpting, I've been doing it for 10 years. So just a little bit of history on the cool. I've been around it when the cool sculpting had their first machine and then now into the new one. Here, cool sculpting or Allergan has a very cool device that we use. It's called Cool Tone. Cool Tone is a magnetic muscle stimulation treatment that we use to tone, firm, and strengthen your abdomen, your thighs, and your pelvic area. I have my model Isabel here. This is her fourth treatment. And what it is about how you feel with treatment.
No pain. It's very relaxing for me. I've been feeling after my third treatment, I'm starting noticing a lot of relief, especially around those dimples that we women have. It's very good for that. It's pretty cool. Yeah.
What the cool tone is doing involuntary muscle, so it's moving the muscle and it's toning the areas that we're treating. With the cool tone, we do 2 treatments twice a week, and then we do maintenance treatments. We do have a phenomenal package going on. Cassie or Amber will be able to tell you our package deal when we are done. This is phenomenal to do also as well, again, to strengthen your core for someone that has like back issues, can help them with that strengthening to feel a little bit toner and better. This is the newest addition to our practice. Our lovely ladies here will tell you how much they love it and the great results that we're getting from our cool tone. I'll hand you over to Cassie. Cassie will go ahead and tell you about our package deals that we offer here in our practice with our cool tone device.
Okay, so Cool Tone, we typically offer 4 treatments to be done in the first 2 weeks, like Maddie said. But for this promotion, we are gonna unleash a 3-month membership for $3,000. That allows you to get 12 treatments to one area
How cool was that? No pun intended. All right, so we are actually going to be going to one of my favorite treatment rooms. We're going to be meeting Jess, who is our microblading technician.
Hi, everybody. My name is Jessica. I am the microblading technician for the Burbank office. What microblading is a semi-permanent cosmetic procedure that helps enhance very thin, sparse eyebrows that happen from over plucking, certain skin conditions, even medical conditions can cause hair loss to the eyebrows. So this is a perfect solution for people who don't want to have to do their eyebrows every single day. So what microblading does is it places hair-like strokes in the areas that does not have hair, causing a more natural looking brow compared to like traditional tattooing. Here are some examples. So this patient here has very thin, sparse eyebrows. This is after microblading. And it could be anybody. I mean, any face shape, any color, everything is based off of the person's bone structure. So here we have somebody who has eyebrows done how they normally would do it. Here we see absolutely nothing. And this is after microblading. So now this patient has the luxury of sleeping in for an extra 15 minutes instead of getting up and making sure that she has eyebrows before she goes outside. Usually the appointments are two. You have 2 appointments, usually about 4 to 6 weeks apart. The first appointment is usually about 2 hours. I go over all the colors, the bone structure, how your brows are going to be fitting on your face after we're all done. The second appointment is used for any touch-ups. With microblading, as it heals, a little bit of pigment loss is normal, so that's why it's necessary to have that second appointment. Like I said, it usually lasts about 1 to 2 years, and usually I have people come in every 6 to 12 months at their discretion, just for kind of like a touch-up or like a color boost, just so that the eyebrows maintain that natural look throughout the year.
Jess, what puts you apart from other microblading technicians?
So there are several different types of microblading. There is ombre, there's powder, there's natural brows. I gravitate more towards the natural brows. This allows the patient, if they want to do full face makeup, go for it. Fill in your eyebrows with your pencil. And then if you just want to go out to the beach, you still have eyebrows. So you don't have to worry about getting your face wet or sweating it off or anything like that. The technique that I use allows for the eyebrows to look super natural. They're not going to look very blocky. Like I said, with traditional tattooing, they tend to be a very solid colored eyebrow, which right now that's kind of the trend, but who knows what the trend's going to be 5 years from now. With a natural eyebrow, you can transition into each type of style that comes along, so you're not constantly redoing your eyebrows.
Jess, are you located in both our downtown and our Bourbonnais location?
Currently, I'm only working out of our Bourbonnais office. I would love to be able to expand to our Chicago office. Currently, with everything kind of going on, we're kind of slowly transitioning into that, but hopefully by the end of this year, I would love to be able to do this in Chicago also.
How much does microblading cost in the Bourbonnais office?
In the Bourbonnais office, it is $475. That includes both treatments. So your first treatment and your second. After that, it's an additional fee for any touch-ups, but it's a much lower rate.
Perfect. Thank you so much for your time.
Hi, guys.
There we go, right here. That's why I'm going to hand it off to Kathy.
Hi, and I just want to touch base. Cindy did wave her hand and text us that she is here and she'll be getting the SkinCeuticals basket. So we will not be redrawing for that. Last demo of the night. It's going to be back with Dr. Pinski. This is another great example of the Refresh and Restore package that you'll see at the end of our virtual open house.
You guys are back so soon? Holy mackerel. All right. Our last one of the evening, and you all remember Dominique. We're going to put in a little bit of filler and a little bit of neuromodulator. Dominique has a very, very expressive face. She thankfully is young. She has not lost a lot of tissue in her face. See, I mean, is that a great example of expressive? So we're going to use a lot of neuromodulator. And we're going to do something really fun. You can see that she's got a little bit of laxity. Go ahead and relax. Just sit natural. A little bit of laxity of tissue here. Go ahead and smile, big smile. You can see how this kind of sort of folds up almost like a little curtain when she smiles. So there's a platysmal muscle, we talked about this earlier, that connects to the collarbone. It's a real thin sheet, like a sheet of paper, all the way up to mid-cheek. It drapes over the jaw. And go ahead and say E. If we put some in these little bands of muscle and along the jawline, it actually helps to tighten and redefine the jaw. This is called the Nefertiti lift. It was described by a plastic surgeon, Philip Levy, back in the 70s. Excuse me, back in the 90s. And it's named after Queen Nefertiti, who had this beautiful, almost 90-degree jawline, neckline. So we're going to take advantage of that. It's an off-label usage of neuromodulator or Botox. We should get a wonderful result. So I'm going to go ahead and start with some filler. Again, I like doing fillers first. We're going to put the chair up and back, go for a little ride. Is it comfortable for you? Hopefully. I do want to point out, and I didn't say this earlier, we now use a skin prep for surgeries and for fillers called Lasersin. This is hypochlorous acid. The reason that we love it is it kills 99% of bacteria and viruses, and it's actually been shown to kill coronavirus. It's actually a different coronavirus, but they behave very similarly in their chemical makeup. We would think it would take care of what's currently out there. In addition, it is safe if it ever gets in the eyes or the mouth, so we don't have to worry about that. So again, we are all about safety here in our office. This is a much safer haven than you going out to the grocery store, et cetera, et cetera. So please do not worry about that when you come back into our office. All right, so we're gonna, again, put just a little bit of filler into Dominique's cheeks. She really doesn't need a tremendous amount. You saw us treating Pam earlier. I'm gonna use half the amount that I used with Pam. And before you guys leave us, I have actually finished treating Pam's second side. We're gonna have Pam come back in as well, and then you'll be able to see the finished product of what someone looks like with complete treatment. And again, you can't tell the effects of the Botox because that doesn't kick in, again, for 2 to 4 days.
Dr. Pinski, what age do you suggest thinking about Botox and filler?
Usually right after they get out of the womb is a good time. No. You know, that's a loaded question because it's really not age dependent. You got someone who's very, very expressive. You know, a lot of this is genetically determined. And again, as I mentioned earlier, a little pressure on the cheek, please. Botox is one of those things that I like to stress prevention. So if we wait till crow's feet, for instance, are already deep-seated and etched in, or forehead lines, we're not going to get rid of those etched in lines with Botox. We would have to use a filler or a resurfacing treatment. Botox will prevent them from getting etched in. If you start Botox now and you do it for the next 20 years, in 20 years, you're going to look exactly the same in those areas that you're getting Botox. So to me, that is a home run right there.
And when it comes to different considerations for men versus women or different ethnic backgrounds, do you have any?
Wow, I want to know the person who asked that question. So that's a great question. Men and women, there is definitely a gender difference. Women tend to have a little bit more wider cheek. They have a little bit arch to the brows. Men tend to have a nice flat brow. They tend to be heavy at the jaw, wide jaw. I mean, think of the icons that are out there. Brad Pitt has this nice wide jaw. I'm blanking, but choose your female icon of choice. You know, nice full lips, tapering almond shaped jaw. Yeah, you could say Jennifer Lopez. I'm not gonna bias anybody. So men, we want to use for cheek fillers a little bit more central than we do for a female look. However, the Asian female, Amber, we want to emphasize a little bit more medially as well. The other ethnic differences, not so important with fillers. We need to keep those things in mind. We don't want to feminize a male person or vice versa, or change an ethnic look. All right, we're going to use a little bit of radius. You saw this similarly next door with Pam. We're going to put a little onto the jawline area just to fill in a couple of shadows. And again, just small amounts. We don't need a lot. And lastly, how we doing, Dominic? Not too painful?
I'm doing fabulous.
Good, good, good. All right, Liz, we'll take just a little bit of pressure right there, please. And then the last filler, we're going to use a little bit of Juvederm again. Just a tiny drop right there, and then a little bit, you can see just a little downturn of the mouth. We don't like the sad look. We want to make it neutral. We definitely don't want it upturned. That's a Joker look, which is not so good.
Dr. Pinski, would this be an ideal treatment for someone who has a round face?
Well, yeah, so you know, someone who's got a round face has some obvious advantages. They typically aren't going to need as much of a filler. They've already got a lot of tissue. Also, when we get to the Nefertiti lift, it's great for someone with lax or loose skin, but if they have fatty tissue in this area, which Dominique does not, it's not going to work. It's not going to be bad, it's just you're wasting it, it won't work. And as you can see, these are really just tiny, tiny droplets that we're putting in, and with small, tiny amounts. It's really lifted that up nicely. Relax for one sec. No smile. I know it's tough for you to do. Relax.
You make me smile, Dr. Pinski.
Well, thank you. You make me smile, Dominic. Relax for one sec. Last little bit. So hopefully you can see a nice little bit of difference there. And again, she has had topical anesthesia left in place for 15 minutes. All right. So that's all we're going to do with filler for Dominique. Again, we didn't really need to do much. We were fortunate we got away without any bruising. Liz, let's go ahead. We'll have some ice. We'll do some Botox. And I'll let you rest your head back. Now let's have just a little pressure right there. And relax. This little bit here is just to make sure she doesn't end up with this weird looking arching of the brow, which occasionally can happen if you really haven't been doing this a while. But if you understand your anatomy, we should be able to prevent that. Unfortunately, sometimes even in the best of hands, that can happen.
Dr. Pinski, would you say that this is not an instant treatment? I'm already seeing a little bit of change with Dominique's face.
Yeah, so what you're seeing with filler, you see that right away. But I think filler gets better and better over about 2 weeks because these fillers tend to absorb water. So I always tell patients, don't expect to see your true end result right away before you leave the office. We're going to move that over just a little. Let's give it a full 2 weeks before we reevaluate, before we make a decision. Do we need to do anything else? Botox, on the other hand, as I've said, is not going to kick in right away. That's going to take 2 to 4 days typically. All right, Dominique, I'm going to actually have you just lean forward for a second and take a look into the camera. Just lean forward. One thing I want to point out, and I should have done this before we started, we always look for asymmetries, and we point that out to the patient ahead of time. There's not much asymmetry with her other than what we've created now, but beforehand, there was a little asymmetry. And if you go ahead and just open your eyes and just naturally look ahead, you can see that her left eyebrow is a little lower than the right. And I pointed this out to her before we started, and she said, oh yeah, that's just started happening recently. I don't know why. So we want to make sure we point it out in advance, and we want to make sure we correct for that asymmetry. So you can go ahead now and rest back. So I'm going to actually use a little more Botox on the left side versus the right. We're going to go all the way down.
Dr. Pinski, one of our viewers has a very round face. Are they, oh, sorry.
Yeah, so we addressed, somebody with a lot of tissue in their face as opposed to a gaunt, skinny face. They're not going to need as much filler. However, we may put filler in certain areas to offset that round appearance. For instance, one thing that we will commonly do with Botox, and this became very popular in the Asian population, is to decrease the size of the masseter muscle. One more right up there. And that masseter reduction actually gives a pseudo cheek lift. Those of us, me included, who tend to grind our teeth at night, get an enlarged masseter muscle. And it actually is a very masculine appearance because, again, it gives that squared off jaw. I'm going to have you turn just to the side like that. Actually, let's go ahead. We'll do the 2 of the chin, and then we're going to take care of the Nefertiti.
Dr. Pinski, what do you like injecting in the tear trough area?
I like Restylane in the tear trough. And you could use a number of products. The reason I like Restylane is I don't think you get as much absorption of water in that location. And it's a good filler. Typically in that location, it'll last about 1 year. Turn towards me, please. Thank you. And again, these will help to soften that muscle and make it look like she's had a little bit of cheek or chin implant. So now we're going to have you turn to the side, and we're going to just inject right along the jaw, and then I'll inject these 2 last. And this is again called the Nefertiti lift. And these should be relatively pain-free with or without ice.
One of our patients said that she has a similar structure to Dominique. Would you suggest filler and pairing it with thermage or therapy?
Well, I think that that's a definite possibility. It's hard for me to give that exact answer, of course. But certainly one doesn't preclude using the other. I won't typically use therapy or thermage right after. I would typically wait 1 week, although there's been studies done showing that it could be actually utilized the same day without problem. But I'll usually like to wait a week. All right, that'll be it for the ice. I've got 2 more spots to inject. These are painless. And we're just putting it real superficially. It's into the muscle. I know it looks kind of freaky, but we're not doing anything else. Is Pam available? Oh my gosh. Ninja style. All right. So I think we did everything we set out to do. Looks really good. Hopefully it wasn't too painful.
No, not at all.
All right. Last thing that I want to do is just a little cold gel to smooth things out. And again, we'll just tell the patient, let's not go get a facial or a massage over the next 4 hours. I also tell patients when you're coming in for filler, let's not do this the day of a big social event or the day before a big social event. I know you have an open house tonight, but that's okay. I just don't want to ruin an event if we cause a bruise or some swelling. And I also tell them, let's avoid any aspirin or alcohol, ideally for 3 days prior. These things will have a tendency to cause more bruising otherwise.
Dr. Pinski,
Yes.
are we offering virtual cosmetic consultations, or when are you going to start seeing those?
I'm so happy you asked. So we're going to open our doors June 1st. June 1st, we're going to be doing Botox treatments, general derm patients, and this is all, again, flexible. Approximately 2 weeks after, our plan is to then begin doing injectable fillers and full face cosmetic evaluations. We will be doing virtual cosmetic consults still over the next 2 weeks or first 2 weeks of June. And we will also be doing aesthetic body treatments like you've seen tonight, Cool Tone, Cool Sculpt, Ulthera, Thermage for body during the first 4 weeks. And we will be doing facial aesthetic treatments, including dermasweep, as you saw, at the beginning of July, unfortunately. Again, we're all about safety and wearing masks, and unfortunately the patients can't take off their masks at this time, but we hope that this escalates quickly where we can do that. All right, so Dominique, I'm going to actually have you just stand for a second. We'll switch and we'll have Pam over here just so we can see the finished product.
Can I just tell you that I was kind of nervous with the lift, and I thought that I would be a little bit of uncomfortable, but I did not feel a thing. So I just wanted to let you know that was very painful, or pain-free. Pain-free. Sorry.
I didn't pay her, that's all I have to say. So the main thing that I just want to point out is hopefully we've maintained the symmetry that we started with, and we've minimized, again, shadowing on the jaw. Might have a little bit of swelling and bruising since we just completed treatment. This is all going to settle down and look better again over the first 2 weeks. Botox, you're not seeing any effects yet. How's our hands? Good. And again, the hands can be a little lumpy, but this will all go away over 48 hours. So this is how someone typically walks out of the office after having these types of treatment. Pain-free, hopefully with no bruise. I can't say that's 100% of the time, but if it is, it's minimal. Shall we adjourn back up front?
Yeah.
Because we're done with the demos. Thank you all so much.
All right, if you guys will follow us back to the front. We are on our way back, going to say goodbye to some of our staff, but still have our last, but certainly not least, last raffle giveaway.
Yes, I'd be happy. Of course.
Okay, last raffle of the night. It's a big one. It is one area of Botox treatments for 1 year. So we'll see you 3 times over the course of the next 12 months, and we will treat your 11s, maybe your horizontal lines, maybe your crow's feet, whatever bothers you the most, for 1 whole year. So,
All right, see who the lucky winner is. Erica Neves, can you please raise your hand for us? No? Give
one
it
more chance for
second.
Erica.
All right. Let's see here. Thank you, Cassie. Danielle Beamsterboer.
She is pregnant. That's my friend, and she's watching, and she's pregnant. So we might have to extend it. Also,
She waves.
so we'll see you in a year or so. When you're not.
All right,
All right.
that's wrapping it up for us tonight.
So we want to thank all of you for taking the time out of your busy schedules. We'd like to have a final toast. Cheers. God bless you all. And we hope to see you soon. Thanks to the staff for going above and beyond the call and pulling us all together. Thank you all.
Guys, have a good night. Thank you for watching.
Thank you.